Hello, and thank you for inviting me to this international conference. Especially thank you to Dr. Udham Singh for inviting me to share what I have learned. I was a Pranayam teacher for 13 years, and my professional background is as a university research administrator. So what I share here is a summary of published medical studies, theories that may explain observed results, and clinical guidance to support practitioners in distress. And in my professional role, I work alongside academics, so I am familiar with aspects of research publication and supporting international and collaborative policy making. So published medical studies describe mental health benefits of techniques. These are well known and promoted widely, and these can be advertised from teaching organisations themselves. We also see in lifestyle magazine articles, and health benefits are widely promoted. Medical professionals also directly share health benefits of meditation and breathing techniques to their patients. So these techniques attract a wide range of learners looking to enhance their health and their well-being, and also attracts people with mental ill health symptoms and diagnosed conditions in order to self-manage their symptoms. So I'm aware of a number of clinical trials and medical research of specific pranayama and meditation proposed as a mental ill health treatment for conditions such as anxiety, depression and trauma diagnosed conditions. So there's a number of clinical studies I'm aware of currently taking place in the UK and Canada, and I expect that there are thousands of such studies and clinical trials of various techniques worldwide. So here I describe lesser known published medical research that describes adverse effects of these techniques. Anxiety, panic, mania, flashbacks, dissociation, traumatic re-experiencing, psychosis and seizures are shown to be precipitated and exacerbated in some people, and this is observed by clinical psychiatrists and medical doctors. So this has been published in 16 research papers between 1976 to 2018, and I've summarised this, and I'll talk through some of these aspects here. I've also identified and described theories that may explain both the reported health benefits and adverse effects, and I briefly describe some of the clinical guidance that's been developed for teachers and for instructors to support practitioners in distress. So this research describing adverse effects describes a variety of traditional and modern approaches, and these are published in international medical journals and have remarkably similar conclusions to the best practices developed from across different academic disciplines, evolutionary neurobiology, clinical psychiatry, also traditional Chinese medicine and Ayurveda. So I show how emerging trauma-informed research and practice comes to similar conclusions as the traditional teaching principles of yoga and Ayurveda. And I describe how now is a great time to support and continue these global dialogues and to collaborate together. Meditation-related difficulties are actually pretty common. A recent research study of over 900 people found that 1 in 10 have meditation-related adverse effects that last a month or more and are described as impaired functioning. We can say that where pranayama and meditation are promoted as mental ill health treatment, there are then ethical, legal and practical implications. There are different methods in place to support practitioners in distress. So within traditional teaching of principles, the teacher-student relationship and the wider cultural context and understanding of experiences is likely to be significant. Some modern teaching organisations have developed a different or an additional approach using risk management terminology. So we see health policies, health declarations within the application registration process, and these will typically refer to a doctor and may describe some known adverse effects. Some health policies have exclusion criteria, so they exclude people with specific mental ill health disabilities with diagnoses. And so There are various aspects then of having a policy like this in place. So, for example, there's a whole range of consumer protection laws which may be applicable, disability discrimination law, advertising standards, trade description, and data protection are just some aspects which then need to be looked at if there's a health policy of this sort in place. So here is a summary of a number of peer-reviewed published studies, and the symptoms here on the right we can see have been induced, precipitated, exacerbated by the techniques described. So there are 8 published studies describing the adverse effects of these pranayam, and 7 of the meditation techniques shown here. And what we can see is this article by Dr. Tellis and Nikamal Singh by Patanjali Yoga Foundation actually describes all the techniques, and I'd say this is a key document to look at and investigate further. There's a table there, it's quite comprehensive, of various techniques and observed effects, and we see that in these other papers as well. Each of the published studies describe guidance developed by psychiatrists, and I particularly wanted to describe here these resources developed by Dr. Willoughby Britton and colleagues at Brown University, and they have a dedicated team at cheetahhouse.org, and this is so named because the clinical psychiatry team there would admit people with acute symptoms, and the building there was named Cheetah House. So the team there have developed extensive online resources. I receive inquiries from people through my website asking for support, and I signpost them to this video and to the consultations with the care team there. Demand is high. There's a 2-month waiting list to see Dr. Willoughby Britton, and there's a team in place who have trained for 9 months each and provide their support, often as a result of their own experiences of adverse effects. So we can see here on the right, this is the bio of the profile of Dr. Willoughby Britton, and I quite like the layout of this, and each person within the care team provides a description of themselves in this way, so that people in distress with acute mental ill health symptoms in their practice, excuse me, of whichever tradition, will come to the care team here and can approach a person they feel they most resonate with, and there's a series of consultation prices available. Having read this research, I was struck by the fact that these techniques are shown to both relieve and make trauma symptoms worse. So I searched for reasons why this might have been observed, why this might be the case. And I encourage everybody to check the source documents here. There's various authors regarding, you may be familiar with Dr. Stephen Porges' theory, which we can describe as a theory of evolutionary neurobiology. It appears to be well accepted. There are robust academic discussions about some aspects. Overall, this is well accepted and forms the basis of trauma-informed approaches. There are various authors that have discussed these aspects further, and I encourage everyone to check those source documents. Having said that, I find this video really helpful for describing the polyvagal theory. It's only 6 minutes long, and here the ventral vagal and dorsal vagal functions are both described. These form the parasympathetic nervous system. So the ventral vagal being responsible for what we might know as the rest and digest functions, and the dorsal vagal responsible for the freeze stress response. And we can include dissociation as a symptom, which is observed in people with schizophrenia, post-traumatic stress disorder, and other mental ill health conditions. The word dissociation is also used by some to describe normal everyday experiences, such as driving down a highway, doing a repetitive task and then realizing you don't have any memory of that activity. So this word is also used to describe a meditative state by some, but in each of these published studies that I describe here, the word dissociation refers to the symptom of ill health. Another concept I find really helpful is this idea of thoracic muscle bracing or armouring, and this is mostly an unconscious chronic tension where it's actually providing an additional protection, particularly around the neck, the chest, the abdomen, the pelvis. And in fact, Dr. Gerbag and Dr. Brown, in their studies of pranayam, advanced pranayam, as both a health benefit and an adverse effect for people with PTSD, and they describe, I quite like this quote, they describe what I consider to be thoracic muscle bracing, and they talk about here and lowering the defences, anything that might expose a person to memory triggers, and that could include physical postures, and that then affecting their state of consciousness. So again, find this a helpful way of thinking about why it might be that some people or even the same person might experience both benefits and adverse effects at different times using the same techniques. And this window of tolerance model is a fantastic way to explain these sorts of observed results as well. So here, hyperarousal and hypoarousal observations are described, where dissociation could be described as a hypoarousal symptom. And this particular infographic I find really helpful. I regularly signpost people to this when they come to me through the website for support, and this is actually the basis of quite a lot of the clinical guidance. They describe this concept, which I think is shown quite well here. This infographic is by National Institute for the Clinical Application of Behaviour Medicine in the United States. Previously, I had read in esoteric texts about Ida and Pingala, and it was impressed upon me reading those documents previously about this sense of reverence, even saying those names and approaching this knowledge, which has been so carefully preserved and safeguarded through countless millennia. So having come across this concept of Ida and Pingala, sun and moon within the body, within the nervous system previously, and being aware that trauma is a fairly recent term, I searched and searched for an Ayurvedic understanding of how pranayam may be known to both help and exacerbate trauma symptoms. And I'm very happy to share with you that I have. This is Dr. Vasant Lad, Director of the Ayurvedic Institute in the United States. And I recommend going directly to this video. Dr. Ladd is an entertaining speaker, and I will share with you a quote which I find so helpful. He says that all diseases can be cured by pranayama if it is done properly. If the wrong pranayama is done, then all diseases will happen because of wrong pranayama, and it should be done according to your prakruti, according to your vikruti. He goes on to say that suppose your vata dosha is high and you're doing kapalabhati, then that will have adverse effects. And if your pitta is high and doing bhastrika, then that could have adverse effects. So we have to follow prakruti, vikruti, and do pranayam accordingly. And we can calm down vata, pitta, and kapha in that way. And then he goes on to respond to a question from the audience about which pranayam. He says that Analom Vilom Nadi Shodhan pranayam is balancing between Ida and Pingala. Pingala will provoke pitta and Ida will provoke kapha. So just by doing alternate nostril pranayam, that will help to soothe all doshas. Great, so moving on now. I'm pleased to tell you that within Buddhism and medicine, there's also discussion of these adverse effects as well. And in a series of talks, Dr. Pierce Salguero, this one in October 2021, was speaking about meditation sickness in advance of the publication of his book here, Global History of Buddhism and Medicine. And in fact, these events sold out immediately. I wasn't able to attend, I very much wanted to. And I share here an interview with Dr. Salguero. This is a long quote, but I wanted to share it. He says that according to a medieval Chinese text, transcribed in 454 Common Era, describes meditation sickness and how it can be prevented, but in a way that's deeply rooted in these difficult archaic terms he describes, and even when translated into English, can be inaccessible to the general public. So only those with an extensive religious studies background to decode texts of this sort, making them of little use to the millions of meditators worldwide practicing. And then he goes on, Dr. Salguero goes on to say, as the scholarship around meditation sickness grows, he hopes that the work of religious studies scholars will provide a middle ground between the biomedical approach and the traditional spiritual approach. He says that religious studies scholars are in an interesting position because they can understand the traditional texts and can explain the symptoms in a way that's accessible but still makes sense within the context, specifically here of Buddhist practice, and advocates for more scholarship and publication of data and research about meditation sickness. And he says here this could provide a counterbalance to the mindfulness hype that we've all been experiencing for the last 10 years or so, that has been presenting mindfulness, meditation, as something that's strictly positive and great for everybody. So this is another example of a talk from the same series, and this is specifically to religious scholars. And I find quite interesting this description here about the ethics of sharing that information. So that was a whistle-stop tour of the research that I have collated that describes adverse effects of pranayama and meditation, and the theories that might describe both the observed health benefits and adverse effects for people with mental health symptoms. Personally, I'm excited to bring together these different traditions and academic disciplines, which all to me appear to come to the same conclusions. As I said before, my background is university administration, particularly supporting the design and delivery of training programs and their application processes, translating the latest research and design, research and development knowledge so that local communities and businesses can work together. So within climate change modelling and policy making, I was supporting the translation and engagement with local communities affected by sea level rises, melting glaciers, and things like what crops will grow locally, what water might be available locally over longer periods of time going forward. And what I saw was that international and interdisciplinary approaches to common issues do work and create successful outcomes. Right now is an exciting time, I think, for proponents of traditional yoga and Ayurveda. There's an increasing demand, interest all around the world. Also, there's an increasing, I think, interest in quality standards and accreditation. Of course, we see mental health being prioritised at all levels, nationally, internationally, recognised as being a global issue. We see interest in lifestyle, behaviour changes, and we also see the issues that people with mental ill health face. We see an interest, a drive towards decreasing stigma that people experience. So alongside this, I would say that in terms of consumer protection, there's a lot of nationally, internationally around the world that's been established to protect people from exploitative goods and services and trades. So therefore, there's a number of different aspects which support people with mental ill health as they learn and practice these techniques. So advertising, trading standards, data protection and equalities law can all support these conversations as well. Thank you again for this opportunity to share what I have learned, and these are my details. I welcome feedback, suggestions, conversations, collaboration. Please do get in contact, and I wish everyone at the conference best wishes. I hope you continue to enjoy the conference and conversations. Thank you. Goodbye.